Assalamualaikum and hi everyone. Today I am going to talk about the field that I'm very interested in, which is general surgery. But I am going to focus on a person who are majoring in this general surgery, which is what we call as general surgeon. So in this video, I am going to focus on the facts and related diseases treated by the general surgeon, but I am going to explain the diseases according to the system of the human body. So, for the first one, what is general surgeon and who is a general surgeon? So it is actually a doctor and surgeon that treats patient thoroughly in any ways, including surgery. It will diagnose a broad array of medical condition, including before, during, and after surgery. Next, I'm going to talk about a person that is the renowned doctor in this general surgery field. It is none other than Dr. Michael DeBakey. So, if you guys haven't seen him before, this is the picture of him. So, I'm going to talk a little bit about his background. He was born on September 7th, 1908, which is in Louisiana, United States of America. Why does Dr. Michael DeBakey is so famous in this general surgery field? It is because of his surgical innovations that introduced the roller pump for heart-lung machines in open heart surgeries. He as well performed the first successful coronary artery bypass surgery in 1964. Apart from that, he also served as a mentor to numerous surgeons and played a crucial role in medical educations. But sadly, he passed away on July 11th, 2008, and leaving behind a legacy of innovation and dedication to cardiovascular surgery, influencing medical professionals globally. So, the disease that related to its respective system, which are appendicitis, that is related to digestive system, osteomyelitis, which is related to musculoskeletal system, and lastly, atherosclerosis that related to the cardiovascular system. So what is appendicitis? What is osteomyelitis? What is atherosclerosis? You guys might wondering, what are those diseases and how does that happen? And which part of your body is affected? So, without further ado, I am going to explain it later. So, for the first disease that related to the digestive system is what we call as appendicitis. So, what is actually appendix? Appendix is a small finger-like pouch attached to the large intestine in the lower right abdomen. So, appendicitis, it stands for the inflammation of the appendix due to bacterial infections, feces, or foreign bodies. If we explain it in the physiology aspect, it actually the blockage in the appendix which leads to the bacterial overgrowth, which causing inflammation, swelling, and pressure within the organ. So as the pressure increase, the blood flow to the appendix is compromised, resulting in the tissue damage, and if left untreated, it will eventually rupture. So what are the approach to treat the patient who has appendicitis? So the surgical approach that we use to treat this is appendectomy. So the appendec is actually stands for appendix, and the ectomy represents cutting. So general surgeons often perform an appendectomy, which involves in the surgical removal of the inflamed appendix. The procedure actually aims to prevent the appendix from rupturing, which could lead to serious complications like peritonitis, which is the inflammation of the abdominal lining or abscess formation. Now, we're moving on to the disease that related to the musculoskeletal system, which is osteomyelitis. So if we're looking from the anatomy side, osteomyelitis, it is actually the infection of the bone caused by the bacteria, fungi, or other pathogens. For example, Staphylococcus aureus. So the pathogens reach the bone through the bloodstream or from nearby tissues, leading to inflammation and pus formation within the bone. If we're looking from the physiology side, the bacterial presence triggers an inflammatory response which causing pain, swelling, and redness at the infected site. It will disrupt the normal bone physiology, which affecting the bone remodeling and repair mechanisms. Pus formation can destroy bone tissue and compromising its structural integrity. Looking at the biochemistry aspects, it is actually the immune response that releases chemical signals and inflammatory mediators to combat the pathogens. These mediators recruit immune cells to the site to eliminate bacteria. The body will release enzymes and cytokines which contribute to the breakdown of the bone matrix. So, how does a general surgeon can treat a patient with osteomyelitis? The surgical approach will be performing debridement, which is the removal of infected tissue and drainage of abscesses. These surgical options can include bone grafts or in severe cases limb amputation to prevent the spread of infection. Last but not least, I'm going to talk about the disease that related to the cardiovascular system, and this disease is also quite famous. And the name of this disease is atherosclerosis. So what is atherosclerosis? It is actually the buildup of plaque inside the arteries due to the damage of the inner lining, which is what we call as endometrium. So how did this happen? The atherosclerosis begins with the damage or injury to the endothelial cells lining the arterial walls. This damage can result from factors like high blood pressure, smoking, high cholesterol, and inflammation. When the endothelium is compromised, it allows low-density lipoprotein, which is what we know it as LDL, to enter the arterial wall. The presence of LDL in the arterial wall triggers an immune response. The white blood cells, particularly macrophages, are attracted to the site, and it will engulf the LDL particles and transform it into foam cells. The accumulation will occur. Over time, these fatty streaks can become more complex with smooth muscle cells migrating into the area and depositing collagen. This results in the formation of a fibrous cap over the plaque, which can further calcify and harden. The plaque buildup narrows the artery and affects the blood flow, potentially leading to complications such as blood clots or complete blockage. So, how do you want to help the patient that has atherosclerosis? The name of the surgical approach is what we call as angioplasty. So, how does this angioplasty is conducted? It is by the catheter insertion, which is the procedure involves in the insertion of a thin flexible tube called a catheter into an artery, usually in the groin or wrist, by using the X-ray guidance. Then, once the catheter it reaches the narrowed or blocked segment of the artery, a deflated balloon will position at the side of the blockage, and it will widen the artery and restoring blood flow. In many cases, a stent, which is a small mesh tube, helps in keeping the artery open after the balloon has been deflated and removed. Some stents are coated with medication to prevent the re-narrowing of the artery, which is a process called restenosis.